Okay, good afternoon, everyone. You can hear me? We ready to start? Okay, so today we're gonna have a discussion about the PRP. Welcome everyone. I'm Dr. Arthur Williams from American Wellness Center, and we will discuss today in this webinar how we experience platelet-rich plasma and how it actually revolutionized the healing of sport injuries, the speed recovery from injuries, and the benefits of that. So we normally, everyone is talking about the stem cell treatment, regenerative sports medicine. And the question for everyone is always, what is PRP? So let's play the slide. Can I play the slide again? Just on the slide. Nope. Do this, quickly check it. Okay, so just give us a minute, and we'll just show you a quick video on what is PRP or platelet-rich plasma, and then we'll discuss the benefits and how it advances us.
Or PRP, is a concentrate of blood plasma proteins derived from your own blood, centrifuged to remove red blood cells and concentrated to form PRP. The three main cells types in our blood are white blood cells, red blood cells, and platelets. What do platelets do in your body? Platelets are tiny cells that help the body form clots to stop bleeding at the site of injury. During injury, platelets rush to the site of damage, form a plug, clot, and start the healing process by signaling to other cells and growth factors to help the tissue. Injecting PRP into damaged tissue will stimulate your body to grow healthier cells at the injured site. Because the tissue growth factors are more concentrated in the injected area, the body's ability to heal tissue is enhanced, and healing can take place that was not possible before.
So as you can see, that is a more biological type of explanation of PRP. So from my experience, just to give you some background, where did I start with PRP? I was back in the early years of 2000 working in Australia. Sorry? Sure. And at that stage, PRP was an unknown phenomenon or unknown type of treatment option. So what I noticed at that stage that they used the blood cells or fresh blood for patients with wounds and to cure the injury of wounds, which was very significant because it caused accelerated healing in the patients that I see. So I was fortunate in that stage to continue to go back to South Africa and work with the national teams in the rugby, which is the Springbok rugby in South Africa. And I work with the sevens, the women's, the national team, with the professional athletes. And at that stage, we have a bit of trouble with, healing the athletes, getting the joints better, the muscles, the tendons, and also recovering. And with the options we have was cortisone, anti-inflammatories. And I was very curious about platelet-rich plasma. So Dr. Michelle Haldenaes, she's a scientist in South Africa, and they were working with my cells and using platelets for aesthetic purposes. And I was she was assisting me to refine-tune a platelet-rich plasma preparation for athletes, and meaning for joints and muscular and tendon injuries. And we were quite successful in launching the platelet-rich plasma, and I'm talking about into the mainstream of the professional rugby players in South Africa. So we were able then to go fast forward to 2015. Came to Dubai, and at that stage, PRP was also not very familiar in the South Africa in the UAE field. So I was sharing my information with the Dubai health authorities and with the medical fraternity, and we started then with platelet-rich plasma in Dubai in 2015. So fast forward from 2003 to 2015, then into 2025, where we are now, I was able to do a significant amount of platelet-rich plasma cases. In the period with the professional athletes, we were looking at almost over 200 to 250 cases. But the last 10 years, it really accelerated, where I was able to do almost 1,000 cases and more than 1,500 PRP cases. In the last 10 years, we were able to test out a lot of PRP kits and PRP preparation protocols, and I can say today I've been seeing most of them, and I'm very happy with the process and the protocol we're using at the moment with very high-end PRP kits and preparation methods. Now, we have discussed what is PRP, but just to give you a short summary is that I use always this example that when there's an accident scene, there's first responders, and the first responders came to the scene, and they will realize, oh, there's a fire, there's a break-in, there's a health issue, there's hazards on the scene, whether it's an accident or some injury. So the first responders looking at the scene and then calling the fire brigade, the police, the detectives, the ambulance, the first aiders, helicopters, and whatever. So that is just a practical analysis or scenario. But in the body, that actually happens where there's injury in your body. The PRP or the platelet-rich plasma is circulating through your body like first aid, like first responders, and identifying sites of injury. And that site of injury needs then the growth factors, it needs the clotting to take place, new cells need to enter the area, and then regeneration needs to take place. And that is what platelets are doing in the body. But in terms of injury, sometimes the injury becomes chronic and the injury becomes no responsive to other treatments, or is a chronic triggering factor, whether it's mechanical or structural, that cause the damage, and the body cannot heal it. And therefore, you're going to need that accelerated response from the body. It's like sending additional first responders and additional help to that site of injury. And that's exactly what we do with PRP treatment. We're sending identify the injury site, we identify the structural damage, and we infiltrate the PRP at the site of injury, and then create a scenario where the patient or the body can respond with growth factors, with cellular repair, with a reduction of inflammation, get the blood flow there. And that's why we call today the fast recovery of sport injuries, because we can speed up and accelerate the injury and the structural damage at the point of the injury. So the key factors that's important when we talk about PRP that is determining the success is, firstly, you need to make a correct diagnosis, meaning whether it's your knee pain, back pain, low back pain, ankle, shoulder pain, the clinician, and I'm happy to say that through experience of many years, you can be able to tell what is the damage. And additional information you need is you need to be able to do a diagnostic ultrasound on the structure to identify soft tissue, structural damage, and inflammatory response. Then, in today's terms, we can add to that more treatment options, not treatment options, but diagnostic tools, which is MRI. We can use X-rays, CT scan to help me or the clinician to get to the diagnosis. So once we get to the diagnosis, we then can determine the site of injury and whether it's appropriate or the right treatment to apply PRP and in your case. Now, another factor that's important in getting success with your PRP is that you need to integrate a protocol, because you cannot just put in PRP and walk away and it's fixed. You need to identify other triggering factors, maybe some biomechanical issues, soft tissue issues, recovery issues, supplementations, and the rehabilitation of the patient. If you do not be able to identify and correct those things, the injury will reoccur or the recovery will be delayed. So let me slide further to the plans that we can that will help you to make a decision if you are a good candidate for PRP. Now, as I mentioned, I follow a very integrated model or protocol whereby the injection is supported by supplementation. And the supplementation depends on the patient or the patient's specific health, their age, their sports level, their previous injury, and the expectation to return to, say, a high-level sport or professional sport. Sometimes we just want to get back to recreational sport, and all the patients, they just want to enjoy life, meaning spend time, play a little bit of paddle tennis, walking, sometimes a bit of running. So it depends on the specific patient, but I like to support the PRP treatment with supplementation, make sure that the vitamin D levels are normal. If needed, we add vitamin C and or zinc to the treatment. And then specifically for joint pathology, I will consider glucosamine and or collagen to support the healing of cartilage in your joint. If cartilage have pathology, meaning there's degeneration in your cartilage and that's contributing to your problem, you're going to need the glucosamine and or the collagen treatment, which I will prescribe, and I will advise you how you need to use the supplementation with your PRP treatment. Now, the additional treatments that I sometimes add to your PRP, maybe not on the same day, but certain time during your treatment protocol, is hyaluronic acid, which is a gel type of lubrication, nutrition for your joints, and that I can do via injection in your joints in combination with PRP, or at a later stage if there is degeneration that causes your joints to be painful because of your cartilage that is compromised through injury or through exercise and sport. And that's important because if you return to your activity and the joint surfaces need that lubrication, you're going to need hyaluronic acid as an additional treatment. Then another treatment protocol, modality that I add is shockwave therapy. And this extracorporeal shockwave therapy, I in cases, especially of tendinitis, of chronic tendinopathy, or of calcific tendinitis, meaning there's chronic calcification in the soft tissue, or there's chronic inflammation, I add the shockwave therapy to the treatment of PRP to assist you in healing from your problem. And I will have a few examples of that. Now, there's reasons why the PRP treatment with the supplementation doesn't work, because maybe the diagnosis was not correct. Age plays a role. As you get older, your regeneration and your joints do degenerate faster and the healing is slower. Patients, I find smoking is causing a reduction in their healing ability and their platelet cells. And if you use long-term cortisone injections or tablets and or anti-inflammatories, your body's ability to use the inflammatory regeneration of platelets are reduced. So those patients, I need to tailor-make their treatment so that I can understand that that will not give them the desired outcome if these risk factors plays a role. Then patients, and that's what I saw in the rugby scenario, where there's complex pathology, meaning there's more than 2 or 3 or 4 problems or damage in the same structure, and that's a complex pathology, meaning sometimes we need surgical intervention, and sometimes we need the combination of surgery plus PRP to correct the structural damage. And then 2 other problems with patients who's returning to sport. Sometimes they return too early back to sport, or they're not compliant to the rehabilitation protocol, and that obviously compromises the outcome. So I need to, it's a long process, but it's a very detailed process for me to assist the patient to get better in the desired outcome. Now, just before I end off, I may want to answer a few questions. I have a few of our patients asking, or our visitors today asking about PRP. Yes, PRP is beneficial for back pain and joint pain. As I explained now, I use it for back pain, especially when there is myofascial pain syndrome or trigger points in the lower back. I actually did a case today where we can do trigger points with PRP to relieve those myofascial pain problems or trigger points. And then for joint pain, obviously that I discussed now, joint pain from fingers, ankles, knees, and we're going to do it. It is cost effective because the cost that you spend on surgery, on medication, and then for professional or semi-professional athletes not being able to perform or to participate, there's a lot of loss of income for them. And for the social or the recreational athletes, obviously you plan weekends, you want to go away, you want time spent with your kids, relaxation, you want to do a marathon, sometimes half marathons, or you want to go on outings, and it is a quality of life that is compromised if you have joint pain. And that's why the expense to do your PRP treatment need to weigh out the benefits that you get from a social professional point of view. Fat burners could lead to this issue? Not really. Fat burning medication does not affect the PRP, and or the other way around, it doesn't change the outcome of it. Okay, that's a few questions. There's one more question. How you know, it's good if you can hear this video again, because that will explain to you how we come to a diagnosis, if PRP will... No, that's fine. They can just quickly check again the recording afterwards. So I just want to finish off with a few cases actually, just to make you understand how relevant it is. Knee pathology, very common. Knee injuries from your cases of arthritis, patella tendon, muscle joints, MCL, ACLs, hamstring tendinopathies. If you're familiar with this, or you have an injury like this, you will quite know that once the knee is giving you problems, you're going to be struggling to do your sport. So knee pathology is more than 50% of cases that I do with PRP in integrated protocol. The other pathology is shoulder pathology, very common in your athletes, and also in your recreational sport, and also in your day-to-day life when picking up your kids or bags, or when sleeping, or you're becoming, as you age, your shoulder pathology becomes more prominent and it causes limitation. And therefore, there is a list of injuries that we treat for shoulder pathology, from tendinitis to tears to your labral injuries and even arthritis. Elbow pathology, very common, the classic tennis and golfer's elbow, and here is mainly tendinitis, and in the elbow especially, it's important to be able to do ultrasound and or MRI to determine whether you can will benefit, and to understand what is the structural damage. And then PRP, quite a lot of ankle and foot pathology, from your tendinitis to your plantar fasciitis to muscle tears and tendinitis around your tendon of your ankle and foot. So then the last case scenarios, and this is where I find also common response, is patients with myofascial pain syndrome. Now, this is a terminology, you can search about it, but it is more when you have trigger points, muscle tenderness, muscle tightness, muscle soreness that's causing your neck and your back to be problematic, and you have done your physiotherapy, or maybe you had done your correction exercises, and we can add PRP to your treatment. Now, and again, this is anecdotal evidence from my own experience, is that people before use cortisone, they will use Botox injections for trigger points, and I've used PRP, and I am very happy to say that this is from my previous cases. When I move over to PRP, I have a much bigger success rate treating the myofascial pain syndrome and trigger points, trigger knots with PRP. So there's a few other cases that I did or that I commonly do, which is on the list now: SI joint problems, piriformis problems, gluteal tendonitis, hip pain, shin splints, muscle tears a lot, and then also scarring into muscle tissue. In summary, then, to conclude our presentation today is that for good PRP treatment and with any other medical treatments, you need a good, proper diagnostic workup, meaning diagnosis should be correct and supported by good imaging to identify the pathology, and then one have to set realistic outcomes, just looking at the risk factors, the age of the patient, sport activities, and what pain management is required. I always offer my patient alternative options, meaning physiotherapy to be complemented to the treatment and or other types of medicine. And then to integrate this in the best way is the best way to go forward and have successful outcome and accelerate the response when you have PRP for your injuries. Yes, so thank you very much. I will just have a minute or two for one or two questions. I have a few of our listeners who have very interesting questions. I have Lisa who asked which is the right PRP treatment for injuries, and as we explained, a good diagnostic workup, and obviously in the doctor's case to have experience about sport injuries and the effect of PRP helps you a lot. As you can see, I'm based at American Wellness Center in Healthcare City. It's building 39. We have a sport injury rehabilitation hub, and on the link here you will find my Instagram link and or our American Wellness Center link, where you will find myself, our contact details, so that we can reach out to you, or you can reach out to us for your assessment and or your treatment. Any other questions from our listeners? Okay, so thank you very much for all your time. Thank you very much for the patience, and thank you very much for listening in to us today. This video will be available on most of our social media links from American Wellness Center, so that you can contact myself or the team, and then we can or answer further questions and or assist you in your specific problem that you have. And as you can see, PRP is a broad range of pathology and injuries and conditions that we can treat. And the best is to come in for evaluation, that we can determine what will be specific for you and your treatment. Thank you very much. Bye-bye.